here at Minton Medical Clinic and Aesthetics in Kingsport. I'm joined by Dr. Minton and her entire team. Dr. Minton, thank you so much for having daytime here again.
It's great to be here. Thanks for having us.
Yeah, so first of all, let's talk a little bit about what you all offer here at your clinic.
Well, we have primary care, urgent care, weight loss, medication counseling, and we do a lot of various cosmetic laser procedures.
Yeah, and speaking of cosmetic procedures, we have Jessie standing right next to you. And Jessie, how long have you been here working with Dr. Minton?
I've been here for 7 years, and I specialize in the cosmetic laser procedures.
Oh, wonderful. And so, Dr. Minton, why did you want to include some of the cosmetic procedures and have someone as qualified as Jessie come work with you?
Well, Jessie is certified, and the reason we decided to add this layer into our practice is because so many patients had asked for it. So I aim to please.
Yeah, exactly, right? You want a patient to come in and have access to everything under one roof, right?
Absolutely.
Exactly. And so, of course, we want to talk about some other team members. Your mom is a huge and important player here at Team Minton, right?
She is. She's the director of nursing, and Mom has been with me for 20 years since I opened the doors, and I'll just let her tell you a little bit about her background.
Yeah, and so Evelyn, I know we've kind of chatted before. You have a background in nursing, and you've been a nurse for a long time, right? Tell me a little bit about kind of your expertise.
Well, I've been a nurse about all my life, and I love my patients, and I love the staff that works with us, and we get along really good, and it's just wonderful.
Yeah, and Evelyn is the first face that people see right when they come in the door, right?
She is. She makes all the appointments. They call to talk to her, not me.
Yeah.
And she makes the appointments, and she does their vital signs, and she has been a cardiac nurse for a long time. She worked in ICU and CCU at the hospital, and she can literally hear things that other people just don't hear when she takes a blood pressure or feels a pulse. And I just feel so honored to have my mom be in this practice with me. It's an honor.
Well, and she definitely could be retiring, laying on the beach somewhere, but you choose to come into work. Why do you come into work every day?
Yes, I do, 5 days a week.
Well, why do you choose to come into work every day? Because you love the patients?
I love the patients, and I love my boss.
And don't let her fool you. She is the boss. She runs the place. She's the main player.
And of course, we have to talk about another key player here.
Yes.
And this is Dr. Dyer. She's the medical director here.
Yes, we love having Dr. Dyer, and let's let Dr. Dyer talk about all of her expertise.
Yeah, Dr. Dyer, thanks so much for letting us talk to you. Tell me a little bit about kind of your background and how long you've been here.
Well, I just feel so blessed that Dr. Minton invited me to be a part of this team and a part of this family, really. But I'm local. I'm from Greenville. I've done the majority of my training here in East Tennessee. My base training is in family medicine. I did my residency in Bristol. And then after that, I did a sports medicine fellowship at Virginia Tech, where I had the honor of being team physician for a year, which was an amazing experience. And so I have really a very varied background. I do non-operative orthopedics. I do family medicine. I do things like joint injections, trigger point injections for tight muscles. As part of my fellowship at Virginia Tech, I also learned a lot of osteopathic techniques, such as OMT or osteopathic manipulative treatment. I also have done additional training in medical acupuncture. I have training in the cosmetic procedures and Botox, Juvederm, those sorts of things, and I've done both medical and cosmetic Botox. So I've done Botox for chronic migraine. Additionally, I'm board certified in obesity medicine, so I have experience with that, and I also have some training in addiction medicine as well.
Wow, so you really you're the big umbrella, huh? You cover a lot of bases there.
I do. I have a lot of interest, and I'm the type of person, like Dr. Minton said, you know, if it's something that a patient needs that they're struggling to get somewhere else, I'm always open to learning new things and incorporating those into our practice.
Right, exactly. And so tell me a little bit about what you hope when patients come through the doors here. What do you hope that they get out of coming and talking to you or one of the team members here?
Well, I think our biggest focus is that we take a true team approach to healthcare. So it's not just about, you know, giving a prescription for a medication. It's really talking to the patient, figuring out what the root cause of their issue or their concern is, and then using all of our resources together. And Dr. Minton is just brilliant with her background in pharmaceuticals. And do they really need to be on this medicine? Are they taking medications to treat side effects of other medications? Let's try and get them down to the fewest number of medicines, or ideally no medicines possible. What can we change in their diet? What can we change in their exercise? Just really kind of the whole person approach to healthcare, not just the person or not just the disease, but the person behind the disease.
Right, exactly. And you mentioned team and family, two key words, especially here. And so, Dr. Minton, tell me a little bit about just the team atmosphere. I mean, that's something that really what sets you apart.
Our team has become our family too, and there's two team members that are not here today. We've got Cher Taylor. She's our licensed esthetician. Cher is amazing. I've never met anyone that didn't just fall in love with Cher. And then we've got Melissa Zamora. She's our nurse practitioner, and she's just an asset. She is wonderful. The patients really enjoy her, and she's really good at fact finding, and she really just uses such a sincere approach to every patient. We love having her.
That's wonderful. And of course we want to mention the membership program that you all have here as well.
Oh yeah, I'm glad you reminded me. We do have a medical membership. It's $50 a month, and you can get up to 4 visits if you need them. And if you need another visit past that, it would be $25. So where can you go for $50 a month and get up to 4 visits?
I don't know anywhere.
Now, we will take patients if they don't want to be in our medical membership. They would just pay $100 the very first visit, because we've got to collect a lot of information. And then it would be $75 for each additional visit. So you don't have to join the membership, but I think it's more cost effective.
Definitely, it definitely is. And what's great too is that you have a team care approach, a family here. So Dr. Minton, Jessie, Evelyn, Dr. Dyer, thank you all so much for talking with Daytime. We always appreciate it.
Oh, thanks for having us, Anna. We loved it.
Of course. So if you want to reach Dr. Minton, Dr. Dyer, Evelyn, or Jessie, just call the number on your screen and you can come check out Minton Medical Clinic and Aesthetics in Kingsport.